咁咧，我哋又啱唔啱
？We've got a quorum already, so let's invite the deputations and the administration in.
我未見過嗰份 Chairman's Brief 咁厚，個餅乾都攞埋出嚟食，哇，錄埋音添。你咁好意啊！係女人啊，個個都知啦。高爾夫嗰啲咩吸引委員會嗰啲嚟嗰啲係咪個人嘅團體嚟㗎？等攞荷蘭水過啦，黐線！好啦，咁啊歡迎各。
So I thank the deputations for coming, and I would also like to thank the officials for coming. So please find your seats. This is a special meeting of the Health Services panel. At a previous meeting, the panel discussed a paper on legislative amendments in relation to designating bus interchange facilities, certain bus interchange facilities, statutory NSAs, and also there are other legislative proposals. So today we have a public hearing. I want to say that this is an opportunity for members to listen to the views of deputations and stakeholders. We are not carrying out any consultation on behalf of the administration. The administration is responsible for doing its own consultation. And so the purpose of this special meeting is to enable members to listen to the views of deputations. So this meeting will be from 11 a.m. to 7 p.m. But of course there will be a lunch break and also some short breaks. And this session will be from 11 a.m. to 1 p.m. Each deputation will be given 3 minutes to address the panel. I want to remind deputations that what you say will not be covered by the electoral powers and privileges ordinance. So please tune into the channel that you prefer, the floor channel, the English channel, the Pt1 channel. So please choose the channel that you prefer. So I'll invite the deputations to speak one by one, then the administration will respond, and then finally there will be a Q&A session. So the first deputation is Mr. Chan from the Shatin PTA Association. Yes, Chairman, thank you. I want to say that we are concerned about e-cigarettes. Concerning the ingredients, at the moment, there is no statutory control, and we are worried that the ingredients are in fact the same as the ingredients of cigarettes. We are very concerned. As we all know, cigarettes are hazardous to human health. And I'm sure many deputations will be speaking on e-cigarettes. I want to say that my father died when I was 10, and he died of lung cancer. I want to say that my father's death was largely caused by nicotine, and I understand that e-cigarettes may contain nicotine, and I don't want to see others dying of lung cancer. So I hope that electrical members can try to minimize the hazards caused by nicotine to human health by passing the legislative amendments. I think there should be full statutory control. I think there should be control like the control imposed on cigarettes. Next, we have the Mr. Law from the Hong Kong Chiu Chow Chamber of Commerce. Now, we were established many years ago. Our members are Chiu Chow businessmen and other prominent members of society, and our members have made contributions to society. We would like to make the following comments. First of all, the health warning. According to the administration's paper, the health warning or the area of the graphic health warning shall be of a size that covers at least 85% of the two largest surfaces of the packet of the retail container, and there should be 12 forms of health warning. I think these are workable solutions because at the moment, the health warning only covers 50% of the surface of the packet or retail container of cigarettes, and the existing batch of health warning pictures has been used since 2007. We are of the view that the health warnings should be of high definition. The graphics should be of high definition, and also young people should be able to get the message that smoking can kill. I understand that in overseas countries there are health warnings with photographs of damaged organs, and I think we should also follow suit. And I think with the legislative amendments, then the new health warnings can come into effect. There will not be legal problems like trademark or other disputes. And then the second proposal is to impose a smoking ban at bus interchanges at tunnel portal areas. I think again this is workable. We support this proposal, and we think that for most PTIs and areas where there are many people, they should become no smoking areas. And also I think for areas near schools, they should also be made NSAs. And then the third proposal is electronic cigarettes. Electronic cigarettes have become more and more popular. I'm afraid time's up. Next, Mr. Chung E-Tak. I am a researcher at the Hong Kong U Public Health faculty, and I want to say that concerning electronic e-cigarettes, they are in fact delivery systems, and they are devices that deliver aerosol or vapor for inhalers. Now, in fact, it will not help people quit smoking, and in fact there is nicotine and other additives, and according to our recent research, we have more young people than adults using e-cigarettes. And then second, for young people using e-cigarettes, they have problems with their respiratory systems. And then in fact, those who use electronic cigarettes have a high dependency concerning nicotine. And so I want to say that, in fact, the outcome of our research tallies with the outcome of overseas research. Electronic cigarettes are attractive to young people. E-cigarettes will not help people quit smoking. E-cigarettes may make people more addicted to tobacco. In fact, tobacco contains over 70 types of carcinogenic substances. In fact, I think tobacco has not been banned because of some historical reasons. I understand that at the moment in Hong Kong the smoking rate is 10.7%, and we should not allow e-cigarettes to make people smoke more. I think we should ban the import and distribution of e-cigarettes. I think a complete ban on electronic cigarettes is effective and is easy to implement, and there will be a lot of public health benefits. A total ban on electronic cigarettes will mean that the anti-smoking work in Hong Kong can concentrate on conventional tobacco products. Mr. Wong? I want to say, in fact, I used to smoke. I smoked for 3 decades, but then on the 1st of April 1995, I decided to cease smoking, and since then, I have regained my very fruitful life. Now my family life is very happy. Previously, because I smoked, my 2 sons did not allow me to kiss them. So I want to share my experience with smokers, and so we formed the organization with some health professionals and some who ceased smoking. We have been taking an active part in anti-smoking activities, and we support the 3 measures that have been proposed by the government. Mr. Law from the Chiu-Chow Business Association has already mentioned the merits of expanding the graphic health warning, and then Hong Kong U has already covered the benefits of banning e-cigarettes, and so I will not repeat those points. And I want to say that in fact at all bus stops there should be a smoking ban. I think the tobacco smoke makes me feel very uncomfortable, and I think it's important that bus stops are designated NSAs. We should protect members of the public from second-hand smoking, and also we should try to minimize any temptation to people who smoke.
As a former smoker, I think that using e-cigarettes as replacement is actually not a wise approach. It just fools us. It will not undermine people's determination to quit smoking. I didn't use any particular means except water to help me quit smoking. Recently, we've noticed that if you let young people to consume e-cigarettes, then they will not be far from actually using cigarettes. I've smoked for 30 years, but luckily I changed my mind later on in time, because the people who actually I knew who failed in quitting smoking have passed away. So I now have experience and also value the presence of a clear air environment. Therefore, I very much support the government's 3 proposals. Next one is Dr. Chen from the Hong Kong Property Management Association. Thank you. The association was set up in the 1990s to improve the environment of working areas and also recreational areas in Hong Kong. We have also provided to the Hong Kong SAR government and other organizations on property management. We do support enhancing tobacco control through the 3 proposals. We also proactively promote non-smoking areas in properties managed by our association or companies under our association to provide a high-quality working and leisure environment for the public of Hong Kong. We actually have members who manage 80% of the properties in private residential estates, shopping malls, government properties, car parks, and so forth, and other facilities. In recent years, we've proactively helped the Hong Kong government promote a healthy environment to make Hong Kong a healthy city. All along, we've supported non-smoking policies in shopping malls and other indoor areas. We support the proposal to designate 8 bus interchanges as non-smoking areas so as to reduce the chances of people waiting for buses being exposed to second-hand smoking. And also, I think people who find it, or smokers who find this inconvenient, could choose quitting smoking instead. And I also think that the increase of the size of health messages on cigarette packets and retail containers could have a deterrent effect. We are also very concerned about the development of e-cigarettes in Hong Kong. The shops selling e-cigarettes have increased in number. Some shop owners even encourage customers to try e-cigarettes in the shopping mall, and this actually is in breach of e-cigarette regulations. And because there's not been any evidence disproving the chance that e-cigarettes could release cancer-causing agents, therefore posing hazard to people's health. In overseas, it was found that explosion happened when charging the e-cigarettes. So this could increase the risk of having e-cigarettes. Therefore, our association supports banning e-cigarettes. We also urge the government to come up with clear guidelines for our associations and for the sector to help with law enforcement in relation to e-cigarettes. There should be clear guidelines on how to use e-cigarettes. Thank you. Next one is the VTC Insurance Training Board's chairman, Mrs. Kun. Good morning. Smoking can lead to all sorts of diseases. Therefore, when taking out insurance, the client needs to claim whether he's a smoker, and often they have to pay a premium 40 to even 100% more than non-smokers. So the insurance sector is obliged to enhance public understanding of the risks of smoking. Therefore, we support the proposals made by the government, particularly on extending or expanding the area of private health warnings on cigarette packets. The health messages should actually bring out the risks of smoking. Even you could lay down the diseases to be caused by disease like stroke, aging, cancer, and so forth, posing risk to children's health. So expanding the health warning messages could have a deterrent effect, reduce the attractiveness of smoking. A local survey done earlier showed that smokers will actually have additional expenditure on health-related expenses, which come to $1.13 billion. So this would cause a heavy burden on the entire society. We also know that Hong Kong, as well as the whole world, have seen major accidents like fire explosion caused by cigarette butts, like in the Pat-Sin-Ling Ranch fire, and also the recent blast in the Xinbei city in Taiwan. And the designation of bus interchanges outside the tunnel as non-smoking areas can help protect the public from second or third-hand smoking, and also prevent teenagers from becoming addicted to the habit. Thank you. Next one is Mr. Ma from Hong Kong Disaster Medical Association. Good morning. Our association was set up by a group of volunteers in 2004 by a group of volunteers who helped with disaster relief work. We are a non-profit charitable organization. We want to promote disaster medical relief to help the public live in a healthy and safe environment. Our members consist of, apart from medical auxiliary staff team members, our members also comprise people from the medical and health sectors and other specialists. So far, we've got 200 odd members. We very much support the government's effort to increase the area of the graphic health warnings on cigarette packets. Our association has always wanted to let the Hong Kong public enjoy a healthy and safe life. The act of smoking actually can harm public health. It could also increase people's chances of contracting dangerous diseases like cancer. When there is an epidemic, the smoking habit could also undermine the treatment and chances of rehabilitation for people affected by an epidemic. Therefore, we do think that the government should enhance its publicity and public education on the dangers of smoking. Tobacco products should bear graphic health warnings because such warnings can directly and effectively inform the public about the dangers of smoking, like cancers and so forth, and also the risks involved of contracting, in contracting various other diseases. So such messages would not incur additional expenditures on the government. Even though on existing cigarette packets there are already graphic health warning messages, but they only occupy 50% of the surface area. And tobacco traders still use the packets to develop the brand and promote their products. Therefore, we think that there's a must to increase the size of the health warning messages so as to increase the deterrent and educational impact. Various forms of images or messages could help people to be vigilant, and also the new measure proposes the inclusion of a quit line on the package. I think that would enable smokers to seek help as soon as possible and regain their health again. Therefore, our association hopes that the amendment order can be passed as soon as possible to enhance public health. Next one is from the Phoenix Charitable Organizations, Mr. Ao Yang. Good morning. Our Phoenix Charitable Organization supports the 3 anti-tobacco measures. Apart from expanding the non-smoking areas, increasing the size of health warnings to 85%, that could help indeed effectively remind smokers and people around them the dangers of smoking and to prevent the public from being exposed to the risks posed by secondhand smoking. Smokers will also be encouraged to quit the habit. Tobacco traders would not have as much time to promote their products through graphic messages on the packages, so that young people would not be as easily attracted by the packets. And the warning messages could also warn young people of the risks of smoking. The bus interchanges at the tunnel actually are seen by a lot of people. And there are a lot of people going in and out of the tunnel, and therefore, without the non-smoking areas, there would be a high chance people would be exposed to secondhand smoking. Therefore, the proposal of restricting the area there as non-smoking would protect the chances of secondhand smoking and enhancing the air quality there. Banning e-cigarettes would be an effective deterrent. and also to avoid cigarette products from being popular here. People would begin to understand the similarities between, similar tobacco products, and youngsters will be less encouraged to consume it or to try them. I think tobacco control measures are an important mission of the government to protect public health. I think the proposals put before us are feasible and effective. So our association very much supports them. We hope that the measures can alert more smokers and young people of the risks to their health and encourage them to maintain good air and public health here. Thank you. Next one is Mr. Lee from the Lee Clansmen Association. Good morning. Well, smoking, whether for the smokers themselves or other people, can have health hazards. Our Lee Clansmen Association fully supports the government's effort to increase tobacco control. Firstly, by changing the area of the graphic health warning passages on cigarette packets and of the retail containers, as well as to increase the number of forms of health warning, and also to designate areas at bus interchanges outside the tunnel or within the tunnel as non-smoking areas. Smoking, everyone knows, that it's smoking. Also, smokers know about the hazards to health involved in the habit. So we do support increasing the graphic health warnings on cigarette packets to at least 85% of the surface, so that more people will be aware of the dangers of smoking. We do think that the larger the health warning and the pictures on the cigarettes, the bigger the deterrent effect. Smokers will be better alert to the dangers of the habit and will be more determined to quit it. Our associations also agree with designating bus interchanges at a tunnel as non-smoking areas. If possible, we should extend it to even more or all bus terminus, so that people who don't smoke would be free from the risks of being exposed to the habit. People also think that e-cigarettes could be a substitute for cigarettes, but there's no evidence showing that e-cigarettes are harmless. Therefore, there's no need to replace cigarettes with e-cigarettes. What we're getting now is only one more product to poison young people. I think besides banning e-cigarettes, the government should lay down a policy to control smoking altogether. We hope that the government can actually share the thinking of Koch and to find new ways to come up with measures that are in keeping with the times to reduce further the smoking rate in Hong Kong. Next one is Ms. Chung from Wan Chai District Council. Good morning. I'm from the Wan Chai District Council. I'm also chairman of his Food and Environmental Hygiene Committee. Smoking is a habit that has direct impact on the person and public health. And we always see people smoking in our daily lives, but that actually causes risks to people who don't smoke. People who smoke in Hong Kong now stand at 10.7% of the population, even though it's the lowest in the world, but we still need more measures to control tobacco consumption. We do support the government's proposal to enhance the tobacco control here. The growing health warnings on cigarette packets, well, when it comes to health warning or also public health, the most effective health warning message is the warning actually about hazards to health on the surface of cigarette packets, and this could actually undermine people's interest in smoking, even though the proposal of increasing the warning to 85% of the surface of the packets and retail containers can help people quit smoking and reduce smoking. The quit line will also help, as well as the number of forms of health warning being increased, and also the non-smoking areas that bus interchanges could be useful too.
Hong Kong is a very small and crowded place. In Wan Chai, the area is 976 hectares. We have a population of 990,000, and there are a lot of entertainment activities. But then I want to say that there are many people coming to Wan Chai to work, and second-hand smoking is a very serious problem. When people wait for buses on the pavements, they are subject to second-hand smoke. And for the bus interchanges within the tunnel portal areas, I think they should become NSAs. And the third proposal relates to electronic cigarettes. In overseas countries, the usage rate of e-cigarettes has been fast increasing. Many young people are eager to try e-cigarettes. I understand in Hong Kong, e-cigarettes is not so common yet, but then we can see that in e-shops and in certain and in shops for young people, and e-cigarettes are being sold, and many students think that smoking e-cigarettes is stylish. So this is really a concern. The Christian Family Services Center, Ms. Wong. We provide primary healthcare services and also health promotion services. We want to help members of the public develop a healthy lifestyle. We do not want smoking to cause health problems to smokers and their family members, and we have got acupuncture aided smoking cessation services, and we hope to help deal with withdrawal symptoms. And we also have social workers providing counseling to smokers, hoping to help them quit smoking. And we also have talks and information days, exhibitions, and other publicity activities. We always want to publicize the importance of creating a smoke-free community. We think that the government has to adopt more proactive and effective measures to further reduce the smoking rate in society. We hope that as many people as possible can lead a smoke-free life. Now, some people are able to see smoking for a while, but then they resume smoking again. And I think health warnings are important. There are at the moment 6 forms of health warnings, but then they have been in use for many years, and they are no longer able to really cause a deterrent effect. And so there should be more prominent and new forms of health warning so as to remind young people, children, as well as adults that they should not smoke. We understand that young people like to be stylish and fashionable, and so many are now interested in e-cigarettes. But then we all know the potential health hazards of electronic cigarettes. In fact, some who have tried to quit smoking have tried to rely on e-cigarettes, but then they've told us that in fact e-cigarettes cannot help them quit smoking at all. Now, I'm a mother of a baby who is less than 1 year old, and I want to say that I hate being subject to second-hand smoking when I am waiting for buses at bus stops. The Hong Kong Island Volunteers Organization. Ms. Chen, we support the 3 additional measures proposed by the administration, changing the prescribed form of health warning, designating bus interchange facilities located at the tunnel portal areas as statutory NSAs, and regulating electronic cigarettes. Now, we have 204 member organizations, and these organizations have a total membership of 130,000 people. We are a very influential organization on Hong Kong Island. In fact, we have been asking the government to step up enforcement, publicity, public education. We have also asked the administration to provide better smoking cessation services and to increase tobacco duty so that we can bring down the number of smokers and protect public health better. Now, I want to say that we support the government's efforts to step up measures to try to reduce the number of smokers. We support the destination of bus interchange facilities located at the tunnel portal areas of statutory NSAs because we can discourage smoking and protect non-smokers. And then concerning e-cigarettes, some overseas studies have indicated that, in fact, electronic cigarettes contain toxic substances, and some of them are more toxic than ingredients in conventional tobacco products, and also e-cigarettes are clearly targeted at young people, and so we think that electronic cigarettes should be regulated. We think that the proposed measures can help curb the rise in the number of smokers, especially young smokers. We support the 3 measures proposed by the government. Thank you. Next, we have the HKSPH. And we have Ms. Lee. Yes, Chairman. I'm responsible for community education and volunteer service. I want to say that our experience tells us that young people are very curious. And young people may think that cigarettes are hazardous to health, and e-cigarettes are not as hazardous to health as conventional cigarettes. They also think that e-cigarettes will make them look stylish. So e-cigarettes are tempting to young people, and young people may become addicted. In fact, some parents have told us that young people may start off smoking cigarettes, and then they move on to abusing drugs. And that's why we think that the import, manufacture, distribution and sale of e-cigarettes should be regulated. And we also think that there should be more forms of health warnings, and the size of the graphic health warning should be increased. In fact, the present situation has been has remained since 2007, and so we think that in fact we support more than 85% concerning the area of the graphic health warning. We understand that the quit line number will also appear on the packaging of cigarettes. This is important since some smokers really need to be told how they can get help. And then concerning bus interchanges and also bus stops, I think these should be designated NSAs in the long run. So we hope that government can continue to step up its measures to deal with the problem of smoking. Next, we have Mr. Low Kam Yam. Yes, Chairman. I think in Hong Kong, most public places and offices are non-smoking areas, but still we think there's room to do more to combat smoking. In fact, we do see cigarette butts on the streets, on the pavements, and smoking is hazardous to smokers as well as to those who inhale secondhand smoke. We support the proposal to increase the size of the graphic health warning to 85%. And we also agree that the number of forms of health warning be increased. And then we also support the proposal in relation to the indication of tar and nicotine yields. At the moment, at newspaper stands and at convenience stores, there are advertisements, light boxes on the different brands of cigarettes. I think we should try to find ways to prevent tobacco companies from advertising their products. And I also agree that the quitline number be printed on the packaging of cigarettes. I think there should be more no smoking areas outdoors to better protect the health of the public. I understand that in Thailand, in Nepal, in Uruguay, they have increased the area of the graphic health warning, and in Australia, they've even taken one step further. And I understand that in the UK and in Ireland, they are also taking steps to increase the area of the graphic health warning. So for the benefit of the health of the future generation, we should all support the increase in the area of the graphic health warning to at least 85%. And then we understand that e-cigarettes are getting more and more popular, and we do not know exactly the ingredients. I think time's up. Next, we have the Chunwan Business Association.
Mr. Yu, well, I know people who die because of cancer, and in on the issue of e-cigarettes and health warnings in today's society with such advancement in IT, I'm sure there will be a lot of discussion on the issue. So why can we think of a good way to indeed legislate against smoking? Anyone aged above 18 who wants to smoke, we told them that, well, if you're a university student, you'll be expelled when you're at university, and you won't be allowed to continue study. And work, if the employer can say that, well, if you smoke, we won't hire you for the sake of your health, then that could encourage the persons and people not to smoke. In every fiscal year, we spend a lot on people who smoke, even though they pay tax when buying cigarettes. But they may buy smuggled cigarettes, and that may not help with our taxation revenue. So we could instead charge them the full cost. And in Hong Kong, we could also consider having a transition period From today onwards, in the coming 2 years, we can give people the time to consider quitting. After that, we will actually legislate against it. In Korea, indeed, people would be expelled from campus if they smoke. So we will try to come up with measures to strengthen control. I hope that we can consider legislation so that whoever smokes, they will know, or people who don't smoke would know, what they need to be prepared for the social costs or that could incur, and also what they could anticipate. We can start with legislation, and also want to say that if we want to create a good environment, we need to have legislative changes, and we should control smoking for the sake of our future generations. Thank you. Next one is Mr. I from the Pt1 Commerce and Industry Confederation. Good morning. I'm from the CICO, Commerce and Industry Confederation. We do support the 3 tobacco control measures proposed by the government. Speakers just have cited a number of figures. I'm not going to repeat that again. On packaging, we can increase the graphic health warnings to a larger size. That would be a good deterrent because 50%, the current 50% is too small. Increasing it to 85% could better alert the public of the danger of smoking. And also, banning the sale of e-cigarettes requires legislation in support of it. Now, there isn't any clear guideline for the public on, the similarities or differences between e-cigarettes and real cigarettes. I think we should not only designate non-smoking areas at bus interchanges, we should even ban smoking across the city. So we, on behalf of the CICO Commerce and Industry Confederation, supports the proposed measures. Thank you. Next one is the Eastern District Commerce and Industry Confederation. Mr. Wong, Vice Chairman. Good morning. We very much support the government's 3 tobacco control measures. Just then, a number of speakers said that increasing the graphic health warnings could largely reduce the attractiveness of smoking and encourage people to quit smoking. Many countries have expanded the warnings to a large area already, so Hong Kong should follow suit. The other proposal on designating non-smoking areas at 8 bus interchanges, we believe that could indeed increase people's intention to quit smoking. I was born in a non-smoker family. All of my family members, none of them smoke. In my company, there are no staff that smoke. On e-cigarettes, but, actually they are a cause of worry. We are worried that young people would, because of the presence of e-cigarettes, will try them because they look at it as a trend or something fashionable. So I believe that young people are an important asset of a society and any company. So they are key to our future. E-cigarettes being promoted on the part of various flavor. And some young people thought that e-cigarettes did not contain any tar or other harmful substances. But that's just one way to package the product. I very much disagree with that. I hope that the government can have a complete ban on e-cigarettes to avoid them from being popular. We will continue to support the government in launching measures to help people quit smoking and to increase the number of new young smokers, so that Hong Kong will have clearer air and people have better health. Thank you. Next one is Mr. Pang Wah-hong, Chairman of the Northeast Territories Commerce and Industry Confederation Company Limited. Good morning. I'm from the association. We would support totally the government's 3 measures, including increasing the area of the graphic warnings to at least 85% of the surface of packing and retail containers, and also to designate non-smoking areas at 8 bus interchanges. I think I'm the 20th person who made the same point here. We've all said similar things about the risks of smoking and so forth. Personally, I'm also an honorary chairman of Young People Associations in North Point and other associations. I am in contact with a large number of young people. The graphic health warnings have been used since 2007, and the effect of the warning has actually waned, and people have got used to them already. 8 years ago, well, young people may thought the warning as shocking, but 8 years on, they will be numb by what they've seen already. So therefore, I support increasing it to 85% to create a better deterrent effect. Designating NSAs at bus interchanges within the tunnel portal areas. Well, young people, for them, the more inconvenient to smoke, the bigger the incentive it might be to try them because they take it as a challenge. That's what I found from a number of cases, including my father. He had much difficulty quitting smoking. So it's better to have more NSAs as possible. And thirdly, I would support a complete ban on e-cigarettes. Even though only a small number of people smoke e-cigarettes, but there could be a change. Once it becomes a trend to have e-cigarettes, you cannot curb it anymore. People claim that e-cigarettes have much less harmful effects than traditional products, and that they could help people quit this habit. But then there's no scientific evidence supporting that. So we must ban e-cigarettes. There are so many types of them, and that they could actually lure young people. And figures show that Hong Kong is the country with the smallest population, a percentage of people who smoke at 10.7%. But for young people, the number of smokers has gone up. So for the sake of our future generations, we don't want to be weak nation. We need to support the 3 measures proposed by the government. Thank you. Next one, Yao Chimong Commerce and Industry Company Association Company Limited. Thank you. On behalf of the Yao Chimong Association, we support the government's proposals. Smoking, besides causing health hazards, can also destroy families. Statistics show that every year, close to 7,000 people in Hong Kong die because of passive smoking, causing a medical or expenditure or expenditures or cost of $5.3 billion. So smoking does impact the society in various ways. We do support the proposals, therefore, namely that the graphic health warning should be increased on packets and retail containers, because that could reduce the attractiveness of smoking and enhance people's drive to quit smoking, and also to let the public know about the dangers of the act. And most importantly, it could alert young people to the harm of smoking. In Nepal, Thailand, and Paraguay, these countries, they have raised the messages to even more than 85%. Australia has seen that enlarging the warnings can have good deterrent effect, and UK and Ireland have also taken more tougher measures. And WHO Chief Margaret Chan has said they will consider actually supporting nations that have stepped up their control measures. They've also endorsed the approach of enlarging health warning messages to more than 85%. Therefore, I support the government's act in following the recommendation of WHO. And on the designation of 8 bus interchanges and non-smoking areas, well, these areas are actually always visited by various people. And Hong Kong, indeed, already has laws banning smoking indoors. And even in Beijing, similar control measures have been implemented. So we should indeed do further in actually stamping out smoking in public areas. The ban of e-cigarettes is a good move because it could discourage young people from trying them. Worldwide, e-cigarettes have developed so much that there are now 8,000 flavors, including like various fruit flavors and so forth. So they pose a lot of temptations to young people. So I'm not going to repeat claims about the impact of e-cigarettes. So e-cigarettes will also cause young people to be reliant on nicotine and also would make them less likely to quit smoking altogether. Some countries have actually come up with regulatory measures, even though e-cigarettes are not yet popular. Sorry, time's up. Can I ask the next one to speak? Ms. Yu, Chairman of the Hong Kong Tai Shan Clansmen Association's Hong Kong branch. Well, this special hearing allows us to speak our minds and share with you our views on the government's proposals. On behalf of our Women's Association, I want to say the following. In recent years, on the whole, Hong Kong on general and particularly male smokers have dropped in number. But the proportion of women smokers has gone up instead. Many of them, those aged between 30 to 39 and 40 to 49 make up actually the group with the largest percentage of increase at 1.7 and 1.6%. So more women are becoming smokers, and U.S. studies show that 85% of breast cancer patients smoke, and the death rate of women breast cancer patients has jumped, and to the extent that it's now become the #1 killer among women. So you can see the danger of smoking to women. Researchers have found that the hormones within women actually could trigger cancer among those who smoke. Therefore, the rising number of women smokers in Hong Kong is a cause of concern to us. We do urge the government to strengthen its tobacco control measures immediately through the following means. A. Largely increase tobacco tax. B. An expanding control on the tobacco, and besides that, e-cigarettes should also be regulated. And D. We should also toughen up or tighten our graphic health warnings on packages. A study showed that smokers find that the existing health warnings are not actually do not have much deterring effect. Therefore, we should introduce actually much larger health warning messages to stimulate smokers and to arouse fear among smokers so that they have the determination and the drive to quit the habit. So, on the cigarette packets, the graphic warnings could cover an area of at least 75% on the front package. And on the back, it should cover at least 90% of the surface and on the back of packets. We should also, of course, provide health warning messages there. Thank you. Next one is Mr. Ji from Asia Vibe Association.
Hong Kong is struggling with tobacco issues and tobacco-related diseases every year. Now, for the first time in history, we finally may have a solution, a groundbreaking technology called e-cigarettes. E-cigarettes, as we all know, have been steadily gaining popularity in Hong Kong over the recent years. Evidence suggests that the reason e-cigarettes are so successful is because they provide smokers with a realistic alternative to cigarettes. This means smokers are less likely to return to cigarettes compared to nicotine patches and chewing gums. And because there's no combustion, e-cigarettes release no tar and other chemical compounds found in traditional cigarettes. Studies indicate the health risks of e-cigarettes are likely to be minimal. And consumer goods such as fast food and alcohol have also been proven to be harmful, yet these are freely available in the consumer market. Yet our initial response is to just ban the use of e-cigarettes, which we find irrational. Every new invention that has brought progress to mankind has had its disadvantages and advantages. whether it being the first car, the first airplane, or even the first new medical device, has always brought along some unknown risks. Today, we can't imagine a world without these inventions. But what if we had a government at the time who had banned these inventions? Can you imagine a world without these? In the same way, the goal of e-cigarettes has never been of complete harm elimination, but a matter of harm reduction. I'm sure it's not in the health service's aim to protect e-cigarette cigarette trade and prolong the epidemic of smoking-related diseases. But by banning e-cigarettes, that will exactly be the unintended effect. Hence, we propose to regulate the sale of e-cigarettes instead of banning them in the following 5 areas. Number 1, prohibit sale of e-cigarettes to minors. Number 2, regulate responsible labeling and packaging. Number 3, establish manufacturing and quality testing standards. Number 4, randomly testing e-cigarette products claiming to be zero nicotine. And lastly, number 5, through public education. We hope by issuing out these 5 steps, the government will take a responsible initiative towards e-cigarettes instead of just simply banning them. Thank you.
跟住香港家庭教育學院嘅余先生，
係，各位早晨。
Next, we have Mr. Yu. We are a non-profit making organization. We were established over 5 years ago. We have served over 200 organizations, including government departments, primary and secondary schools, and we have served many teachers, parents, and students. Through our activities, we learn from parents that they want to provide the best environment possible for their children to grow up. But then in Hong Kong, we have smoke everywhere. This is because smoking is still allowed in many outdoor areas. And then the health warnings. We have been using the same 6 forms of health warnings for quite some time, and they are no longer able to achieve a deterrent effect. And then we know that there are e-cigarettes becoming more and more popular. We do not know exactly what the ingredients of e-cigarettes are. We only know that young people are curious. They want to try new things. They don't want to feel outdated. Now, in fact, these e-cigarettes are available at shops targeting young people. Young people are welcome to try e-cigarettes, and as a result, many young people may ultimately become smokers. Now, in fact, the government has done a lot to bring down the number of smokers in Hong Kong, and the government must not relax its efforts. Government should do more. In fact, we want all bus stops to become NSAs, but we understand the difficulties, and so we support this measure to designate bus interchange facilities located at the tunnel portal areas as statutory NSAs. And then second, the health warnings. Yes, we support 85% or even more. And then now we know that e-cigarettes is a budding problem in Hong Kong, and we think that government should take rapid and early action against e-cigarettes. In fact, we are taxpayers. We know that every year a lot of taxpayers' money is spent on providing medical treatment for smokers. And so as taxpayers, I think we are entitled to ask the government to do more to try to reduce smoking. Next. Mr. Chan, I want to say that in fact for those heavy smokers, 1 out of 2 die from smoking, and then in fact there is a 50% chance of premature death on the part of smokers. Now some young people may think that they will not get addicted, although others are addicted, and then they do not know the ingredients of e-cigarettes. In fact, when we ask young people whether they know anything about e-cigarettes, they tell us that they know very little. They don't know what the ingredients are. And at the moment, there is no legislation to regulate the content of e-cigarettes and also where e-cigarettes come from. And some young people may start using e-cigarettes, and then they may go on to smoke cigarettes. And e-cigarettes is in fact not an effective way to help people quit smoking. And the packaging on the cigarette container is a very important medium for the government to get in touch with the smokers. We support the expansion of the area of the graphic health warning to 85%. We also agree that the number of forms of health warning from 6 to 12, and we also agree that there should be the health warning that in fact smoking does kill. And also it's important that the quit line number appears on the packaging, and I think the warning tobacco kills up to half of its users is effective. All right, thank you. I thank all the deputations for having come and spoken. I'll now invite members to ask questions. Chuan Kwok Chu, Albert Chan, and Pun Shu Peng. Each member will have 3 minutes, including replies. Mr. Chuan Kwok Chu. Yes, I thank the deputations for coming, Chairman. I think in this session, the majority of the deputations support the government's proposals. At the moment, it seems that there is very little that we can do about e-cigarettes. There is no legislation regulating e-cigarettes, and we don't know how exactly the government is proposing to regulate e-cigarettes. So I want to ask the chairman whether there will be legislation to regulate e-cigarettes. But of course, making laws takes time. So in the interim, before there is legislation, will there be some administrative measures for e-cigarettes? And then second, will you step up public education? It seems that many of the deputations are very concerned about the problem of e-cigarettes, but then some are now promoting e-cigarettes as something that is fashionable and attractive to young people. Yes, Under Secretary. Yes, Chairman, I want to say something about e-cigarettes. As stated in the paper, we hope to legislate for the import, manufacture, and advertising of cigarettes. But of course, as Mr. Zhang has rightly pointed out, it takes time to enact legislation. And in the interim, government will step up public education. We will be starting a public education campaign on e-smoking or e-cigarettes rather. And then as to whether we will put in place some administrative measures, we have to first of all consider what administrative measures are effective, and we'll also have to have discussions with the Customs and Excise Department and the Department of Justice. So with support from members, we will go down the legislative route. But then Mr. Zhang would like to know whether what you're going to do to promote public or to educate the public in the interim. In other words, before there is legislation, there will be APIs, announcements of public interest, Chairman. And in fact, Dr. Wong from the Department of Health can tell members more about what the Department of Health will do. Then as to whether we can implement some administrative measures before there is legislation, we can consider those measures. But of course, we'll also have to consider when or what the legislative timetable will be. Now, in fact, the deputations, many of them do support legislation. But I want to ask the deputations whether they've got any suggestions for the government concerning administrative measures in the interim. All right, anyone? The deputations, many of you have said that you think government should do something about e-cigarettes and to regulate e-cigarettes. Many of you think e-cigarettes are problematic, but then at the moment there is no control. So what suggestions do you have for the government?
I'll be speaking in English. I hope that's okay. It seems like the first issue the most pressing issue for most of us seems to be the exposure of electronic cigarettes to the youth below 18. Now, it seems like there are many areas we're concerned with, mainly what's inside them, how to regulate them, who to sell, who not to sell to. But I think the most pressing issue would be for controlling distribution and selling of e-cigarettes to the youth. So temporarily, I recommend or suggest implementing interim regulation, just right out transferring the same kind of regulations of selling to minors of cigarettes, just using the same thing for e-cigarettes, banning it to sale below the age of 18, and if anybody does ask to purchase them, you should ask for a regular ID card or whatever it may be. And this should be implemented through convenience stores or shops or whatever they may be. Yeah.
Okay.
It seems that Mrs. Kuhn has a suggestion for us. I think there should be enhanced public education. Many young people simply do not know the ingredients of e-cigarettes. Of course, young people should not use e-cigarettes. But then I think one of the main problems is that young people do not know the ingredients of e-cigarettes. They do not know that e-cigarettes are hazardous to human health. They only know that they want to try because they are curious, because this is a new and trendy product. I want to remind the government that we need to put in place some administrative measures in the interim, because I'm worried that if there are no administrative measures, then in doing your public education, you will in fact be helping to promote e-cigarettes. Now, because you can't just carry out public education. There must be administrative measures, or else you will be helping to promote e-cigarettes. All right, anyone? Ms. Chong? Chairman. Yes, in the long run, of course, we need legislation to regulate e-cigarettes in Hong Kong. But then the problem is that e-cigarettes are now gaining access to school children. Young school children and young people do not know that e-cigarettes are harmful to their health. So I think the greatest problem at the moment is that young people do not know the ingredients of e-cigarettes. So I think there should be more publicity. For example, there should be talks at morning assemblies for school children about the ingredients of e-cigarettes.
Mr. Yu, Chairman, I think for children, we need to spread the message that I may have got it wrong. But they may have got the idea that e-cigarettes as just a new product. Parents said that they and children find it something new, and they're curious about it and have no idea about its side effects. So, but now parents do want to try them, and children want to try them in the absence of regulation. So why don't we just have legislation confining e-cigarettes, consumption of e-cigarettes to smokers, adult smokers? And when university students and children want to try them, we will make them something that illegal. Okay, next one is Albert Chen. Thank you, deputations, for taking time to attend the meeting. I think young people are so fortunate that, so many professional groups and individuals are so concerned about the impact of smoking on them. So we are actually now trying to get more attention for the benefit. But I do hope that when it comes to the impact of smoking on health, Hong Kong government, on air quality control, noise nuisance, or air pollution caused by air traffic, is something that is not regulated at all here. I think the air pollution caused by air traffic actually is more serious than pollution caused by smoking. Also, the sea traffic, the air pollution is so important here. It's such a high level that indeed, actually 40% of it is caused by the movements of ships and vessels in our sea, and they're causing tens and 100 times more harmful consequences to public health than that caused by smoking. People have mentioned about the pressure on the medical system caused by smoking, but medical studies worldwide show that drinking indeed cause a lot more stress and medical expenses than smoking, because drinking results in domestic violence, traffic accidents, or other, for example, losses to workplace because of colleagues who couldn't make it to work after drinking binges. So all academic studies, I'm not talking about studies sponsored by tobacco companies, academic studies confirm that drinking actually has far more negative impacts on young people in society than smoking. So I wonder, all the deputations who are here, what you think of the problem of drinking. Well, I need to clear my interest. I don't smoke, but I do drink. I really hate the actually odor of cigarettes. But so many studies have shown that, and public policy studies indeed need to look at the priorities and the impact on society. Which issue has a large impact on society? And for the more serious impact or problems with large societal impacts, we need to get more resources to tackle that. I know some people are particularly against smoking. Like I always say that York Chow always wanted to, get rid of smokers. Well, maybe he wants to comply with the WHO measures in order to win an award in the future. In the days when the tobacco tax was increased, there are two categories of people who were affected. The first category was the newspaper vendors on the street. After the tax was increased, their business went down by 30%, but nobody listened to the grievance, a cry of these newspaper vendors on the streets. Nobody paid attention to the livelihood issues. York Chow paid no attention to them as well. When they submitted the report on increasing tobacco tax, they paid no attention to the impact on vendors. For young people, the other category of people affected was old people, people who've smoked for 30 years or more. Increasing the cigarette tax actually posed a lot of burden on them. They wanted to quit, but they couldn't. They could either try to buy smuggled cigarettes smuggled cigarettes are of actually inferior quality, and that could cause a lot of harm to their health. Or these old smokers may skip breakfast in order to buy cigarettes, to be able to buy cigarettes. So have you thought about the impact of increased tobacco tax on old people? Your child could say, well, they can just stop smoking. But these people couldn't help themselves. They have had the habit for 30 years. How can they keep the habit? So I'd like to ask policymakers to look at, firstly, well, for any new policies, young child actually fail in his duty at all. He would just want to achieve fame for himself, at the expense of the livelihood of general public. Next one. Well, thank you, Chairman. And adaptations. Of course, smoking has this to health. That's something that we all know and we all agree with. There's no need to dispute that at all. The question is how we're going to regulate it and reduce number of smokers. For e-cigarettes, as we agreed last time, we need to increase we need to have legislation and stepped up control on them. But I'd like to hear from the deputations and the administration as well on the publicity and public education. Paper last time said that in public education, the government has done some preparations. Just then we heard about the rising number of women smokers. And the paper says that by the end of 2014, there will be a campaign, anti-smoking campaign targeting women. I don't know how effective that campaign has been. So I'd like to hear from the deputations, what do you think of the public education done so far? And can the administration also respond to the fact that, well, KOSH, indeed, or the Tobacco Control Office issue 190 summons. What are the age distribution and the gender profiles of people given the summons? And also, we've seen 19,000 cases of tobacco quitting administered by the hospital authority. Can you provide us with some information on people who sought help from HA on quitting smoking? And lastly, on the appeal of e-cigarettes to young people, has any schools got any plan to educate young people about the risks of e-cigarettes? What does the administration think of the effectiveness of its publicity campaigns? It's also got the anti-smoking campaign across the 18 districts. So KOSH, what has KOSH done, and what does it think of the effect of its work? So maybe we'll ask the deputations any response to the members' concern. Mr. Yu? Chairman, earlier on the Hong Kong government actually has within schools done various work. Therefore, there are some healthy schools now in the community, whether in terms of drug control or any health campaigns. They are actually happening within schools. I hope that in the future we can actually step up publicity against e-cigarettes in schools as well. Just the members mentioned that pollution in Hong Kong comes from various sources, one of which is sea traffic. I've noticed that too. The Hong Kong administration has implemented new legislations that impose control on the kind of oil used by ships coming into the port of Hong Kong. But have we got any way, before legislation comes into being, to actually at least can we equivalent, that is, have a relevant control on e-cigarettes similar to the control imposed on cigarettes? Dr. Chen? Thank you, Chairman. Before legislation becomes reality, we think that we can enhance civic education. Besides that, for e-cigarettes in public areas or shopping malls, I think within shopping malls, smoking is banned altogether. So I'd like to ask, in the past, we've seen cases where someone is caught smoking indoors or smoking e-cigarettes. In the future, we can actually lodge as prosecution. Maybe the administration can clarify this. According to existing laws, it said that smoking e-cigarettes within shopping malls is that against the law. I think we also need to step up publicity and public education, not just within schools. In the 18 district councils, under the councils, there are committees, a specialized committee on creating healthy cities. So I think we can indeed step up our liaisons with district councils. Mr. Chen from the Sha Tin Parent-Teacher Associations. Yeah, we were talking about during this interim period, what can we do? I think on the issue of e-cigarettes, we still not aware of the risks and the harmful substances, if any, present in e-cigarettes. So can the administration do a study on, find out and confirm the risks of e-cigarettes? I think we have to do that first before we can implement public education in schools or in the community. We need to know what are the dangers, harms of smoking e-cigarettes first. Before we can really get rid of them from the community. Otherwise, if we just keep repeating the claims against e-cigarettes, then we may end up indeed promoting e-cigarettes. Now, I know that there are harmful substances in e-cigarettes, but not everyone is aware of the risks involved. When it comes to staging civic education, we need to be aware of and be able to tell the public about the harm of smoking e-cigarettes. Okay, Christian Social Service, Ms. Wong. I was thinking, in response to what Mr. Chen said, that when we support legislation, as we heard earlier, when we increase tobacco tax, there were negative impacts on some minority groups. But as an NGO, we are concerned about minority groups. We do want to speak out for the underprivileged. But when you look at the harmful effects of smoking to the entire community, either in terms of expenses, medical expenses, and so forth, I think we cannot just concentrate on the harm done to minority groups. We do need to shoulder the cost altogether. We can help look after the needs of some minority groups, but we cannot, just because of concern for these minority groups, not do anything to address the larger problem. Okay, the hospice group, Ms. Lee. Well, just then someone said that we need to enhance the publicity against e-cigarettes. Please note that for young people, before we have a comprehensive assessment of the dangers of e-cigarettes, we need to be careful not to go too far in promoting e-cigarettes, because otherwise young people would try them out of curiosity. In the past, I've seen that tobacco traders try to reach out to NGOs and to promote the concept of smoke-free campus. But we need to be sure whether we're doing a good thing or bad thing in promoting this so-called concept of smoke-free campus.
So we really need to assess very carefully what we should do and the impact of what we do, because I'm worried that if we do public education, we may in effect be promoting e-cigarettes and attracting young people to try e-cigarettes. Yes, Undersecretary. Chairman, thank you. Many deputations have mentioned the harmful effects of e-cigarettes. In fact, in October, the WHO, in its report, said that the ingredients of e-cigarettes included nicotine and also propylene glycol, and also the inhalation of such toxic substances would cause diseases, including stimulus to the respiratory tract, cancer, and other diseases and health problems. Yes, I understand that when we carry out public education in relation to e-cigarettes, we have to be very careful. We should not be advertising e-cigarettes. We should be highlighting the harmful ingredients in e-cigarettes so as to deter people from trying or using e-cigarettes. In 2014, we had the Smoke-Free Women Smoking Cessation Promotion Program, and concerning information about the program, and also breakdown concerning the smokers. I think Dr. Wong from the Department of Health can supplement. Yes, thank you, Chairman. I am really grateful to be able to take this hearing, to attend this hearing. Now, concerning the fixed penalty tickets we issued. We issued 6,600 or 85% to males, and then about 15% or about 1,700 to females. And then age distribution, 15 to 19, about 400 tickets, and then 1,000 odd for the next group, and then 30 to 39. 40 to 49, 1,000 odd, 50 to 59, 1,400, 60 or above, 975. So you can see that most of the tickets were issued to those between 20 to 59. So some people say that smoking prevalence has increased among young people, but then it seems that most of the tickets were issued to those between 20 to 59. 5.8% of the tickets were issued to those between 15 to 19. And then concerning e-cigarettes, now we have CAP 371, and in these sedentary non-smoking areas, e-cigarettes are not allowed. In fact, the Tobacco Control Office has issued 3 tickets in relation to using of e-cigarettes in NSAs. So is it that, say, in a shopping mall where there is an NSA, it's illegal to use e-cigarettes, right? Yes. I think members like Mr. Zhang have made a very good point. They warn us against ultimately promoting e-cigarettes when we carry out public education among young people concerning e-cigarettes. Yes, we know what we need to be very careful. As the Undersecretary has pointed out, WHO has issued a very authoritative report. And in fact, it's the WHO Tobacco Control Framework meeting report. In other words, the signatories to the framework agreement have had a discussion, and they have concluded that e-cigarettes are not effective in helping people quit smoking. In fact, we have public education activities for young people as well as for adults. But then as to what we should do in schools, No, I want to say that in fact we and many NGOs do a lot of health promotion work in schools, and from September this year onwards, we will start interactive education activities in primary and secondary schools on e-cigarettes. We are not trying to promote e-cigarettes. We are seeking to tell school children the ingredients of e-cigarettes. We want to tell young people and students that they shouldn't think that using e-cigarettes is a trendy behavior. And then there will be a government API on e-cigarettes, and we will try to target women and young people, and we will also highlight the fact that in fact it is unlawful to use e-cigarettes in an NSA. All right, I think time's up. I understand that most of the deputations support the 3 measures proposed by the government, but then they also are concerned about what the government will do in the interim pending the enactment of legislation. So we'll continue with the public hearing in the afternoon. We will start at 2 p.m. Thank you. Thank you very much.